Okay, the open myomectomy shouldn't be a problem. I recommend an open myomectomy because if you do it through a scope, it's not approved by FDA to do it that way because you're morcellating tissue and you don't get a feel for it. And there can be small fibroids that are abutting the uterine lining that can cause problems. And the only way to get them is by feel. And believe it or not, these Pacinian corpuscles in your fingers are an incredible invention of God's that really help the surgeon dramatically if he can just get a feel of that within the muscle of the uterus to feel the fibroid. And I think it's important to get every fibroid out when you do the myomectomy, especially the ones closer to the uterine lining. And so open myomectomy is just fine if they did a good job. I don't know. In terms of finding the best spot to put the embryo, I don't think that's true. I think you want to have the entire uterine lining to be good because you can try as hard as you can to put it in the right spot. And with our ultrasound, we can try very hard to avoid the area where there might be a fibroid or a polyp. But nonetheless, they're irritating the whole uterus, even if it's in a small area. And you put the embryo in a so-called good area of the uterus, that fibroid or that polyp is still irritating the whole uterus. So you're not really protecting that embryo from being discharged. So if it's a polyp, it ought to come out. If it's let's say if it's a fibroid that's pushing into the uterine lining, well, we can take that out through a scope, hysteroscope. That may take several scopes to really eventually get it all out, but that works really well. My colleague, Dr. DeRosa, does a beautiful job on that. Might take several sittings to do that, but an open myomectomy is not a problem unless it's a fibroid that is inside the uterus, inside the uterine lining. And if it's inside the uterine lining, we can manage it quickly with hysteroscopy. So not quickly, but easily with hysteroscopy. So I think the idea of trying to place the embryo where the fibroid is not, or where the polyp is not, is a fool's errand, because the whole uterus is going to be irritated by the presence of that intrauterine polyp or fibroid. So better to get rid of it with a myomectomy if it's protruding into the uterine lining.